As we speak, doctors are trying to find out more about a rare but serious inflammatory disease that is linked to COVID. This after Colorado reported a record number of cases last month. Hospitals reporting 29 cases of multisystem inflammatory syndrome in children. That's also known as MISC here in Colorado. The CDC expects those numbers to go up while they investigate more possible cases in the month of December. In most cases, kids either had the virus or were exposed to it, but the symptoms may not appear until 4 weeks later.
So some of the time, the parents don't even know that their child had COVID, and it's just when they come into the hospital that we do appropriate testing and we find evidence of past COVID infection, and then they realize, oh yes, we had this exposure.
Well, therein lies the problem. So in trying to inform parents, we're joined by our 9 Health expert, Dr. Paul Coley, to try to make sure we keep kids safe. I guess that's part of the problem, that because children infected with COVID, it tends to be mild, so maybe some parents don't even know that their kids had it, and it puts them at risk for a serious complication.
That's exactly right, Tom. 99% of these cases were linked to direct evidence of SARS-CoV-2 infection, with 1% of cases being linked to indirect evidence or kids being around somebody who may have had COVID. But the challenge is exactly what you said. You could have mild or no symptoms at all and then present with this potential life-threatening complication. We don't yet know what causes the complication, but it appears, and the theory is, that it's some sort of a systemic vascular or blood vessel inflammation triggered in many of the organs by the infectious agent. Now, what's interesting about this is it does follow some unusual patterns. So it tends to affect male children a little bit more, so 57% male as opposed to 43% female. We're also seeing that greater than 70% of cases are occurring in children from communities of color as well. The average age tends to be about 8 years old, but it can affect children as young as less than 1 all the way up to 20 years. We're not seeing it in adults, so it's still a lot of unanswered questions about what's causing this.
Some of those numbers make me wonder if some of those cases, more with young boys than young girls and maybe more in communities of color, that we're not spotting COVID in those bodies as well. And then how do we know, though, that's what I wanted to ask, is how do we, if you don't spot COVID, how do you spot MISC? Is it easy to spot? Will it be clear that your child is sick?
It's not always super easy to spot early, but it does declare itself. So one thing that I really encourage parents to do is to test their kids frequently. And I think you make an excellent point that the male predisposition, as well as possibly the communities of color, just means we may not be testing our kids enough. Now, it is important to spot it early, though, because it does affect the prognosis if it's treated early and spotted early. So any signs or symptoms of MISC, such as fevers, abdominal pain, diarrhea, rash, muscle aches, the child being more irritable, anything like that should prompt a call to the pediatrician. But on a bigger scale, I think we ought to be testing our kids more, especially as they start to head back into school. And they're not in the pipeline for getting a vaccination anytime soon, so their risk for COVID is going to continue to remain relatively high as compared to those adults.
I know we're really just starting to learn more about MISC, but when you talk about kids going back into school, we know COVID is contagious. The new variant is said to be more contagious. Do we know if MISC is something that is also contagious as we think about putting kids back in classrooms?
And that's an excellent question. So as far as we can tell, we don't believe that the children are necessarily actively contagious when they get MISC, because remember, this is a late complication, usually about 2 to 4 weeks after the active infection. So many of the children that are testing positive for MISC have serological or antibody evidence of having previously had COVID infection. So MISC itself appears to be an inflammatory complication of the virus, not so much an infectious thing like COVID is. But to your point, it's really important to emphasize prevention in our kids as they head back to school, particularly those measures such as hand hygiene, keeping a distance, wearing the masks, things that kids tend to just not remember to do very well, but it is so important for us to make sure. So I would say prevention is the biggest thing that parents can do right now. By reducing the risk of COVID, you're going to reduce the risk of MISC. Testing, as we talked about, is a cornerstone, because if your child tests positive for COVID at any signs of or symptoms, you can keep your radar up for MISC 2 to 4 weeks later. And then, of course, you want to recognize that MISC early so you can get treatment right away.
Well, it seems like it's harder these days to keep your kids and yourself healthy, but we continue to learn more, and that tends to be one of our best weapons, is being smart, being aware, and then turning that into action. Dr. Pyle Coley, it's always good to talk with you. We'll see you again soon. Thanks.